Hi, everyone. Thanks for joining. If you haven't been on yet today or yesterday, my name is Erin Foley, and I'm co-president of the National Adrenal Diseases Foundation and your moderator for this inaugural conference. I am pleased to introduce Laura Beilke, who is a staff attorney with Triage Cancer, and she'll tell you a little bit more about that organization in a minute. And she's going to be going over resources and tips for navigating insurance, financial, and legal issues. So hopefully this is going to be really helpful for many of you out there. And with that, I'll hand it off to you, Laura.
Thanks, Erin, and thanks everyone for being here today. So just to tell you a little bit about Triage Cancer for those who do not know about us, we are a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And a lot of the information that we provide at Triage Cancer is not only relevant for those diagnosed with cancer, but for all of us as consumers of health insurance, as well as those who are diagnosed with a serious medical condition or a chronic health condition, which is why we created a program called Triage Health, which is where we're able to provide free education on legal and practical issues to help people navigate healthcare through resources, materials, and events. So all of the information we'll be talking about today and much more is all available on our website at triagehealth.org. And you may be wondering, why is a staff attorney here talking to you and what is actually legal about health? And the answer is simple. It is almost everything, whether it is why a new drug or a new treatment gets approved by the Food and Drug Administration. How do we get access to that new treatment and how do we get it covered by our health insurance? How can we take time off of work to go and access that treatment? And so much more. So when we talk about what is legal about health, we really do mean almost everything. And to get into the topic of today's discussion a little bit, navigating health insurance is really difficult. They do not like it to make it easy for us at all. In fact, it feels like learning a whole new language when we are looking at our health insurance policies. In fact, 96% of Americans can't even define the most commonly used terms in health insurance. And if we can't understand the terms that are being used in our health insurance, how are we able to feel confident in the plan options that are available to us? How do we feel confident in actually being able to navigate that health insurance and actually effectively use that health insurance? So before we get into some tips around effectively using our health insurance, I want to go over some of the basics. So here are the most commonly used terms in health insurance that we think everyone should know. So first, there is a monthly premium, which is a fixed dollar amount that we have to pay each month just to use our health insurance or just to have our health insurance. So even if we never go and receive medical care during the year, we still have to be paying this monthly premium. But then there are terms associated with the cost when we do use our health insurance. So first there is the annual deductible, and this is a fixed dollar amount that we have to pay first before our health insurance even kicks in and starts to pay for any of our medical expenses. So someone could have a $500 deductible, or maybe they have a $5,000 deductible. That amount is going to depend on the plan that you have. Then there are co-payments, and these are also fixed dollar amounts that we go and pay when we receive certain types of care. And I kind of like to think of it as an entrance fee to going and seeing our doctor, because we're typically going to pay this before we actually go into that office to go and see our doctor, or before we go and get a specific type of medical service. So someone could be going and seeing their primary care physician, and maybe they have a $10 copayment, or they're going and seeing a specialist and they have a $30 copayment. The amount of that copayment is going to depend on the type of policy you have, as well as the type of provider or service you are going and getting. Then there is the coinsurance or the cost share, and those are two terms that mean the exact same thing. They're used interchangeably, but it is the difference between what our health insurance is going to pay for our medical expenses and what we're going to be paying for our medical expenses. So let's say we have an 80-20 plan. That means our health insurance is going to be paying for 80% of our medical expenses, and we're going to be responsible for 20% of our medical expenses. Then there's the out-of-pocket maximum, which we would argue is probably the most important thing anyone should know about their health insurance policy, because in a worst case scenario, this is the most that we're going to be paying out of pocket for our medical expenses during the year. So someone could have a $5,000 out-of-pocket maximum, or maybe they have a $10,000 out-of-pocket maximum. Again, the amount is going to depend on the type of policy that you have. And because out-of-pocket maximums are so important and they can be kind of difficult to understand and how they actually work, I want to walk through an example of how they might work. So I'd like you all to meet Dan. Dan has a health insurance policy with a $2,000 deductible. It is an 80-20 plan, and he has an $8,000 out-of-pocket maximum. Dan unfortunately has an accident and he has to go to the hospital and spends a week in the hospital. After leaving that hospital stay, he ends up with a $102,000 hospital bill. How much of that bill is he actually going to have to pay? And for the sake of this example, we're going to assume that he's had no other medical expenses during the year. So this is the first medical bill he's receiving under this health insurance policy. So I want to walk through how we actually get to the answer. So first, he's going to pay $2,000 because that is his deductible amount, and that's going to leave $100,000 left of his bill. But because he has an 80-20 plan, he's now going to be responsible for 20%. So he's going to be responsible for $20,000 out of that whole $100,000 bill. But because he has that $8,000 out-of-pocket maximum, and he's already paid $2,000 towards his deductible, he actually only has to pay another $6,000 of that $20,000 bill, and then he'll have reached his full out-of-pocket maximum, and his health insurance will pick in and pay the rest of that bill. So in total, he only has to pay $8,000 out of the whole hospital bill. And with this example, I'm absolutely not suggesting that $8,000 is not a lot of money, because it is a lot of money. However, it is a lot better than possibly having to pay the full $20,000 if he didn't have that out-of-pocket maximum at all, or potentially the whole $102,000 hospital bill if he didn't have health insurance at all. So it's really important to understand how that out-of-pocket maximum works so that we can understand what to expect to pay out of pocket for the whole entire year. If you'd like to hear those health insurance terms again, or even this example again, this is a part of one of our animated videos on health insurance basics. So that is it for some of the basics I wanted to go over. And now I want to talk about where we actually get our health insurance. And in the United States, we're actually only getting it from 3 different places. We're either getting it directly from the insurance company, or we're getting it through the government. And by that, I mean like Medicaid, Medicare, military veterans plans. But about 50% of Americans are still getting their health insurance through their employer. And at Triage Cancer, we strongly believe it's important for individuals to know all of their health insurance options so that they can choose the most effective health insurance policy for them. And because of that, we do have a lot of resources on health insurance, including quick guides, animated videos, and recorded webinars. So with all of the options that we have, even though there's only those 3 sections within that health insurance triangle, there are multiple options even within those 3. So how do we actually compare those options to make sure that we're choosing the most effective one for us? And I want to walk through an exercise of how you actually compare health insurance options. I'm going to be using marketplace plans as an example with this exercise, but the situation will apply even if you're maybe comparing employer-sponsored plans to each other, maybe marketplace to an employer, COBRA to a marketplace, or even your Medicare Advantage plans. The suggestion we're going to talk about for comparing plan options will apply in all those situations. So here we have 3 health insurance options that are available to this individual through the marketplace. We have a bronze plan with a $200 monthly premium, a $6,000 deductible, and an $8,000 out-of-pocket maximum. a silver plan with a $275 monthly premium, a $2,500 deductible, and a $6,000 out-of-pocket maximum. Then we had the platinum plan with a $400 monthly premium, a $0 deductible, and a $2,000 out-of-pocket maximum. Now, just looking at these plans, can we actually tell how much that plan is going to cost us by the end of the year, and also which plan is going to cost us the least by the end of the year? And the answer is no, we can't just tell by looking at them. We actually need to do some math. And the way that you do that math is you take the monthly premium and you times it by 12, because that's how much it's going to cost us to have the plan for the year. And then we're going to add to that the out-of-pocket maximum, because remember, in a worst case scenario, this is the most they're going to be paying out of pocket for medical expenses during the year. So if we do the math for all three plans, the bronze plan ends up costing us $10,400 by the end of the year, the silver $9,300, and the platinum plan $6,800. So after doing the math, it turns out that that platinum level plan actually saves us around $2,000 by the end of the year, even though I'm sure all of us would get sticker shock at the idea of having to pay a $400 monthly premium. But that's because we aren't taking into consideration that out-of-pocket maximum while we're initially looking at the plans. So doing the math is incredibly important to understanding the costs of having our health insurance. The costs just play one role when we're comparing our plans. There's also a couple of other things we want to consider, and that's the network of providers as well as our prescription drug coverage. So we want to make sure that any providers that we're going and seeing, any hospitals or facilities we go to frequently, that those are considered in network for our health insurance plan, as well as any prescription drugs we are taking are also covered by our plan. Because if we don't check that, our out-of-pocket medical expenses could end up increasing a lot, or we might end up having to find new providers or try to figure out some exceptions for that prescription drug coverage. So doing the math, checking our network of providers, and checking our prescription drug coverage are extremely important considerations when we're comparing our health insurance options. And we also have a couple of resources to help with this, like our animated video that goes over some of these key considerations. We also have a health insurance comparison worksheet that can help guide you through the math of comparing those costs of those health insurance plans. So now I'd just like to go over a couple of different opportunities where we could help lower our costs with our health insurance. So I mentioned previously that about 50% of Americans still get their health insurance through the employer. But that begs the question of what happens if I lose that employer-sponsored health insurance? What if I need to take time off to care for my health or to go and get treatment, and I end up losing that employer-sponsored health insurance? And there is a federal law called COBRA that allows eligible individuals to elect to keep their employer-sponsored health insurance, and it is the exact same employer-sponsored health insurance when you choose your COBRA, or when you choose to elect COBRA. So it's going to be the same network of providers. Also, anything you've paid towards your deductible and your out-of-pocket maximum will continue once you elect COBRA. One con that we hear a lot when people consider COBRA is the fact that it can be expensive because you will now be responsible for 100% of your health insurance premiums. So those monthly premiums can seem very, very high cost, but there is a program that we wish more people knew about, which is called the Health Insurance Premium Payment Program. And this is a program that is available at the state level through the state Medicaid program. And unfortunately, it is an optional benefit, so not every state has this. But what this program is that if you qualify for Medicaid, but you have access to an employer-sponsored health insurance like COBRA, the state will actually do a cost analysis to see if it is more, or is it less expensive to pay for your COBRA premiums or to pay for all of your care through the state Medicaid program? And when we're talking about a serious medical condition or a chronic health condition, odds are it is less expensive for the state to pay your COBRA premiums than to pay for all of your care through the state Medicaid program. Again, this is an optional benefit, so it's not available in every state, but if you are interested to see if your state does have this program, I highly recommend looking at our charts of state laws under our Medicaid navigation chart. We do have information about which states do and do not have this program. So another place people get health insurance is through the state health insurance marketplaces. And these are basically online shopping malls where the only thing you can purchase are private health insurance plans. You can also use the marketplace to see if you qualify for your state Medicaid. So that can be a really helpful way to utilize the marketplace. But another benefit to purchasing a health insurance plan off of the marketplace is that there is financial assistance options that can help lower either your monthly premium or even lower your out-of-pocket medical expenses. So it would lower what your out-of-pocket maximum is. And as of 2025, there is more financial assistance now than there really has been before because of the Inflation Reduction Act. In fact, 4 in 5 customers on healthcare.gov were able to find a plan for $10 or less a month. Plus, for people who are making more money, so we're making over 400% of the federal poverty level, can also access financial assistance to help make the plans more affordable. Unfortunately, the addition of these financial assistance availability is set to end by the end of the year. So in 2025, when it was introduced through the Inflation Reduction Act, there was a specific deadline. So it is set to end December 31st of 2025. I'm sure you've all heard in the news that there has been some conversations around getting the extension of these subsidies. So we'll have to wait and see what happens. But if anything does happen, Triage Cancer and Triage Health will put this information out for everyone to know. So moving on to a type of government-funded health insurance, Medicare. Medicare is a health insurance that is available to individuals who are 65 and older, who have been receiving Social Security disability insurance for 24 months, or who have end-stage renal disease or ALS. And there have been a lot of changes over the years to try and address the rising costs with Medicare, specifically around the prescription drug costs under Part D. And one major change that happened in 2025 was the introduction of a $2,000 out-of-pocket maximum for Part D drug costs. So if you have a Part D prescription drug plan or a Medicare Advantage plan with drug coverage, you now have an out-of-pocket maximum capped at $2,000. We do know that in 2026, that cap is going to increase to $2,100. Another major change that came with the Inflation Reduction Act was the Medicare Prescription Payment Plan. And this is a payment plan that allows you to spread out your out-of-pocket prescription drug costs over the years. This payment plan isn't really about saving money. It's just spreading out your costs, because whether you enroll in this plan or you don't enroll in this plan, you're going to still have the same out-of-pocket expense or total out-of-pocket expenses for prescription drugs, but it just allows you to spread out your costs rather than having to pay a large amount up front at the beginning of the year. This is a voluntary program. You can choose to enroll in it or not. But if you would like more details about this Medicare prescription payment plan, we do have an upcoming webinar next week, and that will go over all of the details of the prescription payment plan, as well as more changes that have happened with Medicare. If someone is struggling with costs under Medicare Part A and Part B, there are programs that can help with the premium, the deductibles, the co-payments, and the cost shares. collectively called Medicare savings programs, but there are 4 different programs within these Medicare savings programs. Each of them have different eligibility requirements as well as different benefits. So depending on which program you're in, it's going to depend on what type of benefit you get out of the program. If you would like more information on the eligibility requirements as the potential benefits, we do have a quick guide to Medicare savings programs. If someone is struggling with their costs under the Medicare Part D prescription drug plans, there is the low income subsidy or LIS or extra help. These help with the premium, the deductibles, co-payments, and cost shares. There's also state pharmaceutical assistance programs that can help with some of these drug costs. This also is an optional benefit, so it's not available in every state. And also, depending on what state it is, they would have different eligibility requirements and different benefits as well. If you'd like more information on the state pharmaceutical assistance programs, I would recommend going to medicare.gov, where you can find all that information. One thing that we would like everyone to know is that if your health insurance says, no, we are not going to cover this specific medical service, you do not have to take no as the final answer. Us as consumers of health insurance, we generally have 2 rights or 2 opportunities to actually appeal that denial. The first opportunity we have is called an internal appeal. So this is where we're going back to our insurance company and saying, can you please reconsider this denial? The second opportunity is called an external appeal. And this is where we're going to an independent third party that is completely separate from the insurance company and saying, can you please review my denial and my medical claim and see if it is medically necessary? And what is so beneficial about these external reviews is that they are binding on the insurance company. So if that external review says, yes, this medical service was medically necessary and should have been covered by your insurance company now has to cover that specific medical service. And I acknowledge that it is so easy for me to come here and say, go through the appeals process when you probably have already a ton of things on your plates, and the appeals process, while I say it's easy for me to tell you to do it, it can be a very time-consuming process to go through. There could be a lot of paperwork, there could be a lot of phone calls. But there is data out there that tells us that when someone goes through the external appeals process, 40 to 60% of those appeals are found in favor of the patient. So that is telling us that about 50% of the time, when the insurance company is saying no, they are getting it wrong. So this is an extremely beneficial tool that we have in our toolbox, especially when we're talking about getting access to care and financial costs. This appeals process is extremely beneficial to use. And we do have a lot of resources to help with this appeals process. We have quick guides, we have recorded webinars, we also have an appeals tracking form to keep track of those paperwork, those phone calls, and also the deadlines that do come about with the appeals process. But even if you've done all of the tips we've talked about, you know all your options, you compare your health insurance options, you access or you use that that appeals process that I talked about, there still may come a time when there's not enough money to go around, and that's where financial assistance comes in. And there's multiple different ways or places to go and access that financial assistance, whether it's through local, state, or county organizations. There's a lot of nonprofit organizations and private programs out there that offer financial assistance. We have a financial assistance resources module where we have gathered information about those nonprofits and private programs that offer financial assistance and put it on that financial assistance resources module. So if you're having a hard time figuring out where to even start and look for this financial assistance, I highly recommend going to our financial assistance resources module. We also have a module on managing prescription drug costs because there are a lot of different private programs out there that offer assistance with prescription drug costs, as well as pharmaceutical manufacturing assistance programs that can help with the cost of specific drugs. And they even provide resources beyond that copay assistance or maybe even free trial programs. They have resources to help with navigation services. So this is some really amazing free resources to tap into through that pharmaceutical assistance programs. We actually have information on a lot of these pharmaceutical assistance programs. We have a whole searchable chart where you can either type in the company name, the disease state, the prescription name, and you can check to see if that pharmaceutical manufacturer does have assistance program. And we've also included a phone number, the program name, as well as the type of assistance that that pharmaceutical company offers. But there are a lot of other places to look for drug discount programs, whether it's GoodRx, Single Care, Cost Plus Drugs. There's a lot of places to go for drug discount programs. We include all of this information on our quick guide to accessing and paying for prescription drugs if you would like more information on these types of programs. So that's all I have for today. If you would come and like to hear more about health insurance, employment rights, disability benefits, estate planning, I invite you to join us for our online conference on October 18th, where we speak all day long. We also do have our Medicare webinar series coming up. We only speak for an hour to an hour and a half on it. And you can also get a recording of these webinars as well. And then if you ever have one-on-one questions that you would like to ask us, you can always contact us through our legal and financial navigation program. You just fill out a brief intake form and then schedule a call at a time that works best for you. We don't provide legal representation or legal advice through this program, but we can help explain the law that applies to your specific situation, identify different options, help weigh pros and cons of those options, and help you take next steps. And that is all I have for you today.
Laura, thank you so, so much. And there's just one or two questions in here for you. But we don't have time to take them today, but
Okay.
we'll do it, follow up by email. And then it's wonderful that you offer those one-on-one contact points. I just want to say I do have some expertise in Medicare as well, and you did a fantastic job.
Oh, thank you.
And I want to encourage everyone on the line that if you need the low income subsidy help or the other, programs that Laura talked about, there's no shame in that, and you should take advantage of it. I have personal experience with an extended family member who refuses to go on Medicaid, and they should be on Medicaid. And there's no shame in it. That's why it's there. That's why we all pay into it. So please do take advantage and reach out to Laura if you need some personal help. Thanks again, Laura. We appreciate you being here.
Thank you for having me.
Yep.